To the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
Good morning, everybody. I'm Rhonda.
And I'm still Chuckalicious, Chuck Williams.
A big event takes place tomorrow. The Area Agency on Aging of the Panhandle will host another Destination Medicare event. If you have questions about your medical coverage, it's probably one of the most confusing things that you can ever delve into. Lots of red tape, lots of bureaucracy, and just lots of choices. We have Mrs. Hancock who's joining us this morning to tell us a little bit about the upcoming event. Mrs. Hancock, last week you had the first of these meetings for Destination Medicare. And you were saying that you had a pretty good turnout and you have even an online component to this.
Right. If you can't join in person, you can join virtually. And we do need you to register. So if you'll contact our office at 806 331 2227, we will help you get registered and give you the information you need if you want to join virtual or if you want to come in person. And one of the good things about coming in person is that we do provide snacks while you're here. So we have coffee and we have some breakfast snacks coming in the morning. Our Brookdale Senior Living has provided those for us. So it's just good to get together and people can ask questions in person, for their specific situation.
Now, how long is this process to get signed up for Medicare? When should you start looking at this?
Well, our focus for Destination Medicare is especially for people who are new to Medicare. Your Medicare magic number is 65. That's when you're eligible. Now, if you're on disability for 24 months, then you're eligible on your 25th month. But most people are eligible at 65. You have 3 months before your 65th birthday, the month of, and 3 months after. So you have a 7-month window to enroll. And most people don't realize it, but you have to enroll at Social Security.
Mm-hmm.
And that's unusual because you think you'd call Medicare, but no, you go through Social Security.
I'm a little bit past 65. Okay, I'm on Medicare. What can you do for me? What am I going to learn there? Is there anything new that I can do to prolong or cut out some of the red tape, etc.?
Yeah, the navigating Medicare is difficult. Like David said, there's so many different facets to this. And we really focus on going to Medicare.gov. That is your place to look at what options you have.
Right.
And also you can look at, if you set up your account, you can look at what, whatever the word is, what claims have been paid on your Medicare,
Right.
or if it's still pending or what's happening there. And then you can also go and look and see if the medications you're taking are covered on a Medicare drug plan or a Medicare Advantage plan. So those are the choices people have that sometimes get them kind of confused and disoriented.
Right.
Because there's a difference. The Medicare Advantage plans provide health care also. So you can get your health care either through original Medicare or through an Advantage plan. So you have choices and they're not easy to make. And I always warn people to make sure they know what that Medicare Advantage plan is offering them and make sure you're covered, because sometimes they'll say that they cover hearing, dental,
Right.
and vision, but at times it's not always 100%. And well, in fact, with Medicare, nothing's 100%
That's
usually.
true.
So yeah, and that's the other, reality is Medicare is not free.
Yeah.
Although we pay into it all our lives, as long as we're working, then we pay the FICA tax,
Right.
and that's what pays for your Medicare. Now you do get uh, premium, deductible. Sorry, I'm really messing up this morning. Premium free Part A, which is your hospital coverage, if you've worked 40 quarters, and that's a total of 10 years that people have to pay into the FICA tax.
Mhm. Now, one thing that we see because it's on every hour of the day, it's on every break we have. You have a lot of different uh, gallery of people who are chirping in different commercials or
Mm.
you do this, and that can add to the confusion. The biggest difference is if you're looking at your Medicare package, you're looking at your things. If someone wants to charge you for the examination of it, should you run away?
Well, you can, are you talking about the examination of the policy
Well,
itself?
no, I'm talking about you see all day, every day these, well, we can get you this, we can get you that,
Right.
we can do this is free in your state.
Right.
Is it just how important is it for people to get away from that type of paid information and maybe reach out to the area agency on aging and saying, "Hey, I need a hand with this."
Right. Well, and that's the thing. Free enterprise, the insurance companies are selling it and they want everyone to know about their plan. And you get your, mailbox inundated with that stuff, and you get
Mm-hmm.
commercials every 3 minutes. And they think, they make a commission on selling their products. So that's why they're really pushing those advantage plans. And they want your business. They want you to come be their customer forever.
Mhm.
And you're right, area agency on aging, we can't sell a thing. Your tax dollars pay for us to help you. So, and we've been around since 1965.
Mhm.
So, if you want information and help without having the pressure of buying something, then we can help you.
It's taking place tomorrow from 9 a.m. until noon. You can also pick up a virtual element of this, so you could zoom in, or you could do it by your laptop or your phone. It'll be held at the Panhandle Regional Planning Commission building, located at 415 Southwest 8th Avenue. And the phone number, if you want to make reservations, if you want to be a part of tomorrow's big Destination Medicare event, call them at 806-331-2227. Or if you have questions about Medicare and what you're looking at and how you can approach this, the Amarillo Agency on Aging of the Panhandle is always there to help you out. Give them a call at 806-331-2227. Don't miss out on this great information. Mrs. Hancock, thank you so much for your time and being a part and letting us let people know they have options in this situation.
Yes, we won't let you wander alone. We're going to help you.
That's it. You could get in on Destination Medicare tomorrow morning, 9 a.m. until noon. Get your spot reserved right now. Call 806-331-2227. We'll take a break. We're back with more chat.